Good afternoon, everybody. Welcome, Gary. It is December 15th. The rain's coming back again, much needed. This is probably our last video of 2021.
That's right.
So enjoy it. Good tidbits here. Let me dive right in. Let's start out with what we usually start with is the epidemiology to see if things are changing in our neck of the woods. So my first slide is data collected by Sutter. So this really reflects the Bay Area via Sutter. And you can see that we have not seen an uptick that most graphs will demonstrate across the United States and certainly across the world. But you also see that we never really came back to our previous baseline. So we're just kind of hovering up there. Then narrowing down a little bit, our next slide looks at Sonoma County. Looks virtually identical, again, no uptick. And so that's all good news at the moment. And then the last slide is a slightly different look, and this is from the hospital. And this is their positivity rate of the tests they're doing. And again, not really seeing much change there, perhaps a little bit of a trend. But Gary, how's it going clinically in the hospital? Are you seeing much difference? Or?
Yeah, so this data represents mostly the ER
Okay.
testing. And so this is mainly symptomatic patients. There's some pre-procedural testing going on. And so a lot of patients are coming to the ER with illness, and we're probably seeing some Omicron in the county, although that genetic sequencing hasn't happened yet. But we're not seeing them admitted. So only a few patients in the hospital. And again, the patients I've seen admitted to the hospital, including someone in their 20s last week. And they did really well, I'm glad to say, but they're all unvaccinated.
Unvaccinated.
So we're seeing the unvaccinated cohort filter into the hospital. And because our county is very well vaccinated, we're not seeing that many patients in the hospital.
Good.
So that's the good news.
Good. So from the epidemiology, things in Sonoma County in particular have not really changed. So that's good news. Gary, let's turn over to you and talk about some general data.
So whenever we get together in this format, Gary and I always think a lot about how can we present data that's meaningful and how can we present data that offers perspective. And actually I ran across this slide and I thought I'd share with everyone. To the left of the slide, I want you to notice the graph. And the graph represents in the United States from 2020 and 2021, what have people died of? And typically, the number one cause of death in the US is related to heart disease, and number two usually is cancer. And heart disease is in the blue and cancer is in the green at the top of the graph. But if you look at the magenta one, the pink or the maroon line there, you can see where we had the first spike in the spring, and then in the winter of last year, COVID-19 was the number one cause of death.
Yeah.
And then as the vaccination rolled out around that time, we saw a precipitous drop in death. So overall, in 2020, COVID-19 was the third leading cause of death in the US. And that's an extraordinary statement. For 2021, with our efforts at vaccination, it dropped to the seventh leading cause of death, which is still in the top 10. But something I heard on NPR, and then it was repeated in the New York Times, 1% of people over the age of 65 have died of COVID in the United States. That's an extraordinary comment. And then we've had over 800 pediatric deaths. We early on thought, the pediatric population will be spared. Almost 1,000 children under the age of 18, and a lot of them very young, have not survived COVID. So it's not that common in children, but it's still not without risk. And again, I think all of this talks about our efforts for vaccination.
Mm-hmm. So Gary, you had, we're all worried about the Omicron variant and what's it going to mean, and of course they're scrambling to get data. It's hard to get data when something's only been around for less than a month, but you found a study that gives us some commentary. You go over that from the UK.
Yeah, so the United Kingdom just produced a big study, thousands and thousands of patients, and they probably have a large cohort of the Omicron variant that are reaching their shores. Europe is struggling with this much more than we are right now, so we can learn a lot from the UK. Now they use slightly different vaccinations. Mm-hmm. So what we've always promised our colleagues is that when we present information, especially if we come to conclusions or recommendations, we want to show you the data. So I really want to show you exactly the data that was released on December 10th to the UK Ministry of Health. This first slide is going to show you two graphs. On the left, I want you to kind of not pay attention to that. That's their AstraZeneca vaccine effectiveness. On the right, the graph, and I'll put it here in blue, on the right is actually the data that the UK looked at with their Pfizer vaccination. Now, let me just orient to this slide a little bit, and it's a little bit busy. I'm going to walk you through it. The vertical line represents vaccine effectiveness. So is the vaccine 20, 30, 40, 60% effective? And measurement for effectiveness in the UK was, were you symptomatic?
Okay.
So anyone with symptomatic COVID illness. If you got the vaccine and never had a symptomatic disease, that was considered vaccine effective. And then after the vaccine is given over weeks, and in this one, 2 weeks to 9 weeks, then 10, 15, and 20 weeks later, how well was the vaccine holding up? In this slide and in this graph, the square solid data points represents a Delta strain, and the round circles represents the Omicron strain. And as you can see here, right after vaccination, and I'll put it in a circle to the upper left, right after vaccination, within 2 weeks, they both responded really well. The vaccine effectiveness against the Delta, against the Omicron, was above 80%. As weeks went by, the Delta vaccine effectiveness of the vaccines started to slip a little bit, but it never dropped below 60%. But for the Omicron one, and I'm going to put a red line there, the Omicron one showed vaccine effectiveness was about 40% after 2 doses of the Delta, 2 doses of the Pfizer vaccine. Then if you give a booster of the Pfizer vaccine, both of them come up. And the Pfizer to Omicron, this vaccine effectiveness was 75%, 76%, and to the Delta was over 80%. So the UK realized very quickly that boostering was really important with the Omicron variant. And so what I've done in the next slide, I've actually summarized this for you. So the UK study went from November to December 6th, just of this last year. They were able to tabulate almost 600 people with the Omicron strain. Over 56,000 people in that period in the UK had the Delta strain. And they noticed that 2-dose series of the Pfizer vaccine, only less than 40% effectiveness for symptomatic infection with the Omicron variant, and 60% for the Delta strain. And then if you gave the booster, the vaccine effectiveness to the Omicron strain went up to 76%, over 80% to the Delta strain. So that's the big message from the UK, is boostering is really important for the new virus strain. The vaccine still holds up, it's still a good vaccine. It's not as great as a 95%, but it's certainly effective because being vaccine effective for symptomatic disease is really a harder barrier. That's kind of taking it to a higher level. Yeah. And so I think that's really going to influence and has influenced the CDC recommendation in the US to really be proactive about vaccination before we get flooded with this new variant.
So this is a boost for the concept of boosters, not specifically for Pfizer. That's just what they happen to have in this cohort of people. So we don't know how Moderna would fare in the same way, but it's just saying boosters seem to be very effective.
So that's exactly right. So the UK didn't use a J&J vaccine. They didn't use the Moderna vaccine. They really pushed their nation with the AstraZeneca vaccine, which we're not using, and the Pfizer vaccine. Okay. I would expect the Moderna vaccine to stack up very much the same as the Pfizer vaccine. They're probably going to be equivalent, and I'm sure those studies in the US will be coming out. We'll learn that in retrospect. Hindsight's always 20/20.
Right. So then you have some information about vaccines. You want to go over that for?
Yeah, so this is Sonoma County data, and as of December 15th, 72% of our population is fully vaccinated. 6.5% have only received 1 dose. So at least 78%, more than 78%, approaching 80% of our community over the age of 5 has received at least 1 vaccine dose. And most of them, 72% of our population is fully vaccinated. And that's really good information. And you can see I've kind of presented this slide here, and you can look at this at your leisure to say what age groups are being vaccinated now. And we're really making good speed already in the 5 to 11 year range. The next slide is the boosters. So boosters important, and Sonoma County's got to jump on that. You know, overall, we can see that 28% of our population has already received a booster vaccine, and over 50%, 54% of those over 65 have received a booster vaccine. So I think we're well on the way. We don't see as much vaccine hesitancy in Sonoma County as other parts of California, and certainly other parts of the country. But again, the message is clear. It's a very dangerous time to not be vaccinated. And I actually had that conversation yesterday in my clinic with another patient who was seeing me for infectious disease reasons, and she wasn't vaccinated, and we had a very open, thoughtful, compassionate conversation. And my message to her was, as a medical group, we care about you, and we care about you enough to tell you that to not be vaccinated right now is a very dangerous thing.
Good. Well, it sounds like boosters are a major focus right now in Sonoma County, where the vast majority of us have had their underlying vaccines. So this next slide just tries to generalize the recommendations for boosters. And it really is getting quite simple now. On the left, you see that everyone ages 16 and older are recommended to get a booster. And this is just recent data, because on the right, you'll see that for 18 and over, you can mix and match, get any booster, just get a booster. But the newest thing, the most recent thing, is Pfizer has been approved and is now delivering boosters for the age 16 to 18. But the one caveat for them is that those individuals must receive the Pfizer booster.
That's right.
Right? So boosters are the thing. Gary, before we leave the Omicron, so there's lots of tidbits coming out here and there. How would you generalize our knowledge about Omicron in terms of contagiousness, virulence? What's your current take as of today?
Yeah, there is a tremendous amount of data coming out, not only of South Africa, but also Europe. We're trying to study in the US. We don't have enough cases really in the US to make sweeping statements. So far out of South Africa, in vitro and with epi studies, Omicron looks much more contagious than the Delta, at least twice more contagious. There's some data in that UK study I just showed that showed, they talked about secondary attack rates in households. It was 10% for Delta, over 20% for Omicron, so at least twice as contagious as the Delta strain, which was in fact, twice as contagious as the Alpha strain. So every variation of the virus seems to be a little bit more contagious when it develops fitness, and that's kind of what we expect over an evolution. Right. So far, and this is preliminary, it seems to be mild. Okay. So we're not seeing this as the Delta strain, for example, went through India and really overwhelmed their hospital capacity. We're not seeing that with the Omicron variant. So far the Omicron seems to be mild. Is it going to be as mild or more mild in the unvaccinated? We don't know. I think it's still dangerous to not be vaccinated with the Omicron, but it seems to be, compared to the Delta, not as severe and doesn't result in as many hospitalizations.
Good.
South Africa is having a swamp of cases, but it doesn't mean their hospitals are full. Their hospitals are full of Delta variants.
Gotcha. Okay. So I did want to ask you to bring up this other topic, because it's, everybody's aware that there are two oral medications being developed. One has received FDA approval, but we haven't heard much more about it since a couple weeks ago when that was approved. So Gary, you have one more slide that brings these up, but what's the current state of these drugs?
So we showed this slide last time, and I'm going to show exactly the same slide. This is not new information. There are two drugs coming out that are going to be antivirals. They have different mechanisms of action. But what you're going to notice right now is you're going to notice there's going to be more information in the press. And I think you mentioned it was in the Press Democrat today about the new Pfizer drug. The new Pfizer drug is going to be called Paxlovid. It's a protease inhibitor against COVID-19. It's not EUA approved yet. But what Pfizer is doing is they're showing internal data that's not peer reviewed. As a marketing strategy, they're trying to get out there to compete with the Merck's drug. And the Merck's drug is going to be called Lageviro. I'm not even sure if I'm pronouncing that right, but Molnupiravir is their drug for Merck, and that's been EUA approved by the FDA. I actually misspoke last time on our last video. It's not $800 a dose, it's $800 for a 5-day course. But that's still very expensive. We don't know where the Pfizer drug is going to come in. They're probably going to get as much as they can from it. Sure. So right now, if you're seeing information, whether it's in the news, on the TV, in the newspapers, it's marketing. Pfizer has this huge marketing strategy. It's not really coming from the FDA or the CDC, and it's not approved yet.
And one big question is who's going to pay for it? Because to date, the government has stepped in with vaccines, with testing, and so forth, but this will be...
Yeah, I think it's still unknown, because monoclonal antibodies covered by federal tax dollars, vaccines covered by federal tax dollars, some of the testing in public health. This might not be, and so that's yet to be determined.
Yeah. Great. Thanks, Gary. Well, that's what we got today. In deference to your UK study and in honor of the Queen, my next slide just kind of says it all. Keep safe and carry on. What we're finding is that it's really back to the basics, folks. It's carry on with what you've been doing all along, and that is wear your mask, socially distance, and be very careful about your exposures, and get vaccinated. We can't say that enough. So the basic things we've been actually promoting for a year continue to hold the stead here for where we're going forward. So that's all we've got. It's really a privilege for Gary and I to be able to disseminate this information to you. For this, this pandemic has gone on far longer than we expected. This is our 40th video, Gary.
Yeah.
So again, thanks for listening to us. I hope this has been helpful, and hope you can enjoy your family over the next several weeks.
Thanks, Gary.